This episode is brought to you by Cell 101 International. Cell 101 International is a leader in cellular biotechnology, mainly focusing on regenerative medicine. Good morning. Today I find myself in a doctor's room. Today we'll be discussing the future of healing, exploring stem cell therapy with Dr. Paramaswaran. In a world where painkillers mask symptoms and surgeries come with scars, a quiet revolution is taking place. Not in the distant future, but right now. In the realm of regenerative medicine. What if your body could regrow what was lost? What if damaged discs, worn joints, and chronic pain could be reversed? Not with metal or machines, but with living cells. Today, we unlock the possibility with the help of stem cells, the body's own repair crew, now harnessed by science. And guiding us through this frontier is someone who stands at the crossroads of surgery and cellular science, Dr. Paramaswaran. Dr. Paramaswaran is a specialist spine and orthopedic surgeon, turning sci-fi into official reality. Strap in, the future of healing starts now. How are you today?
I'm good. Thank you.
Sounds good. Maybe we can begin by sharing a little bit about your own journey into orthopedic and spine surgery and what sparked your interest in regenerative medicine and stem cell therapy in particular.
I'm a practicing orthopedic surgeon with special interest in spine in one of the major hospitals in the Klang Valley. So basically, what interests me in the use of stem cells was we come across a lot of spinal cord injury patients post-trauma. And at the end of the day, the best we could do for them at that time was to just operate on them, fix the spine,
Right.
decompress the nerve root, and hope for the best.
Yeah.
And focus on rehabilitation and so on. But we found out that we can make the cord regenerate by using stem cells.
Right.
Yeah. So from there on, then there was also other interest in stem cells, big interest in orthopedics, because part of aging is to, your cartilage gets damaged in your joints, and therefore you have chronic pain and also immobility.
Yeah.
And we find that stem cells can also regenerate all these things. So from spine injured patients, I moved on to other aspects of orthopedics.
Right. Okay, let's keep it simple and build a foundation here. What exactly are stem cells? In the most layman explanation.
Basically, stem cells are the one that repairs and regenerate our cells.
Right.
So we have a self-regenerating mechanism.
Right.
Of course, when we are young, there's a lot of stem cells available. But as we grow older, less and less stem cells are available for regeneration.
I see.
So stem cells are the most primary cells that goes and repairs and regenerate. That means it can be whatever it wants to be.
That's right.
Yeah.
Okay. What are the main sources of stem cells used in therapy these days and how are they obtained safely? Because, stem cells were a point of discussion since the early 2000s. But, there's always issues surrounding its sources and its ethical and legal details. What are the main sources today that are used in therapy?
All the research was to study what is the best and the cheapest and the simplest way of harvesting the stem cells. Okay. So it started off harvesting stem cells from the patient themselves.
Okay.
Meaning you take it from bone marrow and we replaced it. So it started off with stem cell or cell transplant. Patients had leukemia, for example, and all the cells was killed by, good and bad, were killed by chemotherapy, and then they have to replace this. Right? So they used to get donors from the patient's own relatives,
Right.
And then inject into the patient's bone marrow. Okay, so where the stem cells are, mainly they are in the bone marrow.
Bone marrow.
Right. So That's how stem cell therapy started. But of course, later on, it became widely used for other aspects. So I think in terms of stem cells, we have come to a stage where we can collect from the cord blood.
Right.
Right. That means once the baby is born, we get their cord blood, and that is the freshest and the best stem cells available.
Right. Okay.
Right. Then they moved on to the placenta. The placenta has got several areas where you can harvest the stem cells. And then the Japanese scientist who won a Nobel Prize, he was able to convert an adult stem cell all the way down to embryonic stem cells. Then embryonic stem cells means, the baby is still growing. Okay. Once it's fertilized, the baby is still growing. So in the beginning, they were using embryonic stem cells, meaning that, say, a couple wants to, a childless couple wants to have a baby, and they can't, and so they do this artificial insemination, and usually 2 or 3 is done at the same time. So, and then one is
Viable.
Usually all are viable.
All viable.
And one is the mother can only have one at a time.
Sure.
So when along the way, say something happens to the couple, they don't want to stay together anymore. They don't want any more babies. So what happened to those fertilized embryo? Right. So they then use that to regenerate embryonic stem cells. Okay. But when Bush became president of the U.S., he stopped that because he said that it's unethical.
Sure.
Right. So that's why the research became very intensive to find alternative ways. So one of that was to take an adult stem cell, bring it down all the way to embryonic stem cells, and then grow it, and then give it to the patient. But all that means a lot of work, expensive stuff. So the cheapest way now is you go and get a placenta. A lot of the placentas are thrown away.
Discarded, yeah.
Discarded. And a lot of the time, the cosmetic people collect that. Okay. So now stem cell doctors collect it, because the second thing a Nobel Prize winner won was how to regenerate or replicate the stem cells. Okay. So now you can bring an adult stem cell to embryonic stem cell. Now you get cells, you can grow the cells artificially. You can grow. So with that technology, you just have to collect the best source of, and best and cheapest source of stem cell, which is the placenta, which is in a lot of cases discarded or thrown away anyway, or buried, and things like that. So readily available, cheap source of stem cells.
Right. Within legal and ethical limits.
Yep. So that is, at the moment, that's how we get. Okay. So in the beginning, it was like the fear of, well, I don't want to get from somebody else. I want to get the cells of my own.
Right.
Well, let's say if you're a 70-year-old man, you take your own cells. Okay, the technology, we can make it down to embryonic, but cost you a lot of money.
I see.
And then we collect that cells from your bone marrow, and we regenerate. Don't forget, that's a 70-year-old cell, right? So you want the cells that are just born, right? I mean, they've been there for 9 months, but they're less than a year old compared to you who's 70, say. Right. So because, again, scientists have found out that if you take stem cells from another person, it does no harm to that patient.
Right.
Because it's got a certain coating that prevents our own immune cells to attack it.
Attacking it.
Yeah, yes. So it's a safe.
Okay.
Right? That's proven.
Okay.
So that is why you find that the first one is called, what we are doing now is called allogenic stem cells. That means it's taken from another person, and then is now replicated and given to patients who need them.
I see. All right, let's talk about some specific conditions or types of patients that respond best to this kind of therapy.
Okay, there's two aspects to it. One is the medical aspect, as I said, that cancer patients, for example, especially blood cancer patients, and then they are in orthopedic conditions like in the spine, in the joints, okay? And then there's a neurodegenerative disorders like it's a tough topic, but especially those who are autoimmune tends to respond better than, let's say, or the word autoimmune usually means that the doctors don't know what's happening. And not because not enough research has been done to come to a conclusion at the moment. But they know that anything that's autoimmune responds well, whether it's a neurodegenerative disorder, whether it's your skin disorder, like, for example, you have psoriasis,
Right.
or you have joint issues like rheumatoid arthritis. So they tend to respond better, right? So at the moment, you find that there's a wide range of medical side. And then there's the non-medical side, which we call longevity or wellness.
Right.
So what it means is that, yes, we are degenerating every day, right? We are, because there's not enough stem cells that's being produced to repair and replicate or regenerate whatever tissue that's being damaged. Right? So the more you are on negative lifestyle, the more of your organs and tissues are damaged. Right? So, and your body is trying very hard to regenerate, but then as you grow older, there's not enough.
Right.
So what happens if you look at the if you look at the bone and you look at the marrow, right? In the beginning, is full of red marrow.
Okay.
Right? That's how you regenerate. But as we grow older, right, those become fat.
I see.
Yeah, so this become fat, and they are not good enough to grow new stem cells.
I see.
Right, so they cannot produce the new stem cells. So you find that what are you going to do if you want to live longer, healthier? What can you do?
Right.
So that's the other aspect of healthy living, longevity, and try to minimize chronic disease. Right? So the biggest issue in the world nowadays is chronic inflammation with chronic diseases like diabetes, hypertension, heart disease, and cancer, and so on.
Yeah.
So if you can prevent that at a younger age, then you won't get it when you're much older.
Fair.
Right? You get it when you're much older because it slowly degenerates and the inflammation becomes chronic. So all that takes time, maybe 20 years. So if you can reverse that, then you will have less chance of getting all those chronic disorders.
Understood. So even if you had access to stem cell therapy, maintaining a healthy lifestyle is still important.
Very, very important.
Right. Because it'll impact the outcome of your therapy.
Yes.
Yeah.
See, if a person already damaged their cells and they want a replacement, that's what we're doing. We replace. Okay. But if you don't change your lifestyle, it's going to be a waste, right? So, what are the main lifestyle changes? One, you have to quit smoking and alcohol. Guys, remember that.
Yeah, okay.
Number two is food. Right? Food, we mean nutrition. Okay, we don't talk about diet. What we mean is give up ultra processed food, give up processed food, give up sugar, and just concentrate on natural food, as organic as you can get, right? And move away from red meat. Okay, take more white meat, plant proteins, for example. So that's the nutrition part. I mean, there are many more, but basically that's the key. Second thing is exercise.
Yeah.
Exercise has shown that it will help your body produce more stem cells.
Okay.
So if you look at the blue zone where the people are the longest living, all of them are exercising even in their very old age.
Okay.
Right? So the more you exercise, the more stem cells you get.
Fair.
Right? Number 3 would be sleep. Okay? Because that's how our body repairs. Okay? So you cannot be running an engine 24 hours.
Fair.
Even a lot of places also, the generator changes. Right? Give this rest and this carries on. So sleep is when our body repairs and produces more good stuff. So if you don't have enough sleep, it doesn't have the time to repair.
Okay.
Right.
That's clear.
Yeah.
All right, so let's talk about how it compares. How does stem cell therapy compare with something like PRP, platelet-rich-plasma, or even joint replacement? How does this function differently and a better option maybe?
Okay. First of all, PRP. PRP is actually this almost. It will contain growth factors, cytokines, and many other factors which are floating in our blood.
Okay.
So PRP means we take some blood from you, spin it in a machine, and collect the good stuff, and then reuse it into you. So we don't give it IV intravenously. We inject into the joint, into your face, into your hair, and all
far
that.
more targeted.
Yeah. So what it does is it just helps you regenerate whatever is there.
Right.
Right. The difference that with stem cells is that stem cell has a potential to regenerate longer. It's longer lasting and it's more productive.
Right.
So the thing about stem cells is that when you inject, you can do it targeted. Let's say like spinal cord injury.
I see. Okay.
Like say if I operate on a patient with spinal cord injury, after fixing, I'll use allergenic cells and inject into the spinal cord.
To promote just better and faster
To
healing.
promote all healing into that, because it's been proven that stem cells locally, inject into the area of damage, will regenerate new cells.
Okay.
But you cannot go back, say, 10 days or 2 weeks or a month later, because you'll have scar tissue.
I see.
So the stem cells, if it gets in an environment, say, of A cells, it will change to A cells. So it goes to an environment where there's scar, it'll just become scar.
I see.
It won't become neural tissue. So the earlier, the better.
Okay. So it's most pertinent during time of healing. Would it be safe to say that this applies to most patients coming out of post-surgery? This will be helpful?
Yeah, so it's better to start telling the patient, look, if you got this, we're going to fix the spine so that you can get out of bed and rehab and so on. But what's going to happen to the recovery of the spinal cord? So we always tell the patient, look, the best option at the moment is to have allergenic stem cell injected into the spinal cord. Okay? In the beginning, we used to take the patient's own bone marrow.
Yeah.
Okay, and then send it to the lab, culture it, okay, and then give it back to the patient IV. But then we found out from studies in the US that 3 weeks is too long.
I see.
Okay, so you want it to be within the first week before all other things come in and start fighting for space.
Understood.
Right? So now we tell them, look, your best option is to have stem cell given into the spinal cord, and then later we'll give it to through the drip. Okay, so what happens is when you give to the drip, this primitive cell, the stem cell, has got a homing device.
Okay.
Okay, it will go to where is most comfortable and safe, which is our bone marrow.
Okay.
It goes there and stay there. And what it does is, it tells us, and then the other guys, they're all like sleeping, okay, because they're so comfortable, nobody's bothering them. And all these new guys come and nudge them, hey, come on, man, wake up. Let's go and do some work.
Okay.
And that's when all these other cells, your own body cells, will start to also become active and start to grow. Yeah, it looks like a comic thing, but that's how it happens.
Fair.
So it works like the cells that you inject into the patient's body works like I would say like a fertilizer. You stimulate growth of your own cells. So it's got this homing device, number one. Number two, it's got certain things around the cells that protects it from being attacked by the host.
Okay.
Right? Because our body has got a defense mechanism.
Yeah.
So if we identify something that is foreign to the body, it goes and kills it. It doesn't care what it is, bacteria, virus, whatever.
Sure.
Whatever, there's an antigen. So this primitive cell, the stem cells, they have got a defense mechanism, which our body accepts it, even though it comes from another patient.
Okay. So it's safe to say that after therapy, the benefits go much longer.
Yep.
It impacts the way your body heals for a very long time going forward.
So if you look at it, it's two things. A stem cell that you inject, okay, it's like all cells. It cannot live forever.
Definitely.
Okay, so it's got a lifespan, like all other cells. So you need those to go in and repair whatever damage. You need it to go there and help regenerate new cells, right? New organs. And then you need that cells to go to your bone marrow and stimulate
Right.
whatever remaining, factory you have to produce more stem cells. Right? That is why, as we discussed earlier, just stem cell alone may not be enough. You yourself have to
You have to facilitate healing also.
You have to talk to the cells. Hey, please help me. Be good to yourself. Be a happy person.
Yeah.
So besides, like I say, nutrition, exercise,
Lifestyle. Yeah.
lifestyle changes, avoid all the bad stuff, and mindfulness. Right? You need to meditate, meaning that you need to de-stress yourself.
Okay.
The more you stress, the more the cells don't want to work.
All right, fair. So I'm curious. Can you walk us through the treatment process from a patient's point of view? Assuming I'm interested in this therapy, from consultation all the way to post-treatment, what would that look like?
Okay, usually what happens is that the patient would need to do certain investigations.
Okay.
But assuming they have a spine issue or a joint issue,
Right.
minimum they will need is an X-ray done. Usually it's not done here. They come with those X-rays, okay, and then they will need to do some blood tests. Okay, now the X-ray is very clear because then we know how badly damaged is it, or how much stem cell we need.
I see.
Number two, whether stem cells is better or whether surgery is better, or we got other ways of doing it.
Okay.
So important, say in the spine, we have a structure which is the disc. Okay, so for example, this is the spine, and this is your spinal cord. This is the bone, we call it the vertebral body, and this is what we call the disc. So this is the machine that allows us to bend whatever we want. It's like a shock absorber.
Sure.
Okay. After a while, this shock absorber is going to wear out. Okay. So studies in a few places have shown that you can inject stem cells into the disc, and it can regenerate.
Wow.
Okay. So initially, because as it degenerates, the oxygen level in that area become less and less and less.
Okay.
So the cells there cannot survive, right? So your own body cells have to go there. But if your own body cells are not young, not enough, so you won't repair.
Right.
So what we do is we will then inject stem cell into the disc. And we have found from studies that it regenerates. You get back your shock absorber. So that is one example. And why we do blood tests is basically for two reasons. One is because we don't want the patient to say, oh, I was healthy after I got stem cells. Now the patient says, I've got cancer.
Oh no.
right? So, but there's no such thing. Studies have shown that giving stem cells to patient does not make them have cancer.
Okay.
So basically, every one of us have got cancer cells floating in our body. But our immune system is so good that it doesn't allow the cells to proliferate. I mean, it doesn't allow the cells to grow. They can clump together, become a tumor, but it gets killed by our defense mechanism.
I see.
So giving stem cells to the patient has been proven it does not. But if you do blood tests for the known cancers of patients, and you can then say, look, you're clean, right? You don't have any cells, or you do have something, you better get that sorted out.
Right.
And therefore, so you don't get the patient to blame you, even though we know that from studies that giving stem cells to your body does not increase the chance of getting cancer.
All right, that's good to know. So it's some form of a screening process, the blood test, to check for eligibility and compatibility.
Yeah.
Okay. From your personal experience, as you've administered this therapy to previous patients, what kind of, maybe you can share some stories about some success, maybe some details about how quickly it impacted the patient?
Again, divided into two groups, those with medical conditions and those who are for well-being. Okay? The issue is, how much do we give?
Right.
Is
How
the
is that
question.
decision made?
Yeah. At the moment, the decision is arbitrary for well-being.
Okay.
But for certain conditions, we know because they can do. Okay, because let's say the joint, you can grade the arthritis by grade 1, grade 2, grade 3, grade 4.
Okay.
And then you give all whatever cells, okay, 25 million, 50 million, 100 million, 200 million. And then you see the response across the board.
Okay.
And then the idea is to choose the lowest.
I see.
Right. The reason is because cost is one of the big factor.
Okay.
Right? And that's number one. Number two is how many times do you repeat in a year?
Yeah.
Right. So for the knee, for example, it will good results will last up to 2 years. Wow. Right. So do I therefore after 2 years come back for repeat? That's possible. Could you send your car every 5,000 kilometers or twice a year, but your own knee, you don't want to regenerate the cells. Right? So I have a patient from India, and he's very, very obese, bad knees, and I have access to show when he first came, and after 1 year of treatment, he had every 6 months. So he had 3 treatments, and we can see now that the cartilage has grown. So previously what we used to do is we'll put an arthroscope, like a telescope, into the patient's knee and clean up, wash up, everything. And then we will take some of the patient's cartilage cells, we harvest it, and we send to the lab to grow. Once it's grown, 3 weeks later or 4 weeks later, we do another scope and go and paste it.
I see.
Right?
Okay.
And then we do a third scope about 3 or 6 months later to see the regeneration of that. And it's been proven it does regenerate.
Okay.
So, but now we don't need to do that. We can give stem cells and we know that it will regenerate because the cartilage cells are...
Okay, so far more straightforward.
Yep.
Okay. Well, it's important that we speak about all this because the way stem cells sound, they sound like a solve it all. Okay, but it's good that we are being realistic here. So you can apply stem cell therapy, but you still need to be mindful about creating an environment where you are assisting the healing. So you cannot maintain a rock and roll lifestyle after therapy. You're not going to see the best results.
Yes, I have one patient like that. Where, I think it's like, some people happen to be that way.
Okay.
Where they think that I get stem cell, I'm going to be younger, I'm going to feel healthier, and therefore now I can eat what I like, drink how much beer I want. No, it doesn't.
Doesn't work that way.
It doesn't work that way.
Okay.
Right? So And that patient was disappointed and saying that, first time the stem cell works, second time it's not working.
I see.
Basically, when you look at his lifestyle, first time he behaved, inverted commas, second time he did not.
He was transparent about this.
We have to ask him, look, what are you doing?
Yeah.
And because we know that if first time it works, it should work again, right? So the most difficult thing is not only that, but how much stem cells do we give?
Yeah.
So if you ask me that question, there are a few studies that were done in some countries where for example, a baby that is born premature,
Okay.
that means less than 28 weeks, okay? And one of the big things that hinders their the survival is they don't have a certain thing called surfactant in their lungs. Which makes the lung grow and all the lung cells and all that. And that is why most of these babies, they will be incubated, kept in a neonatal ICU until they produce enough of those themselves to be able to breathe themselves well.
Okay.
So when they look at these babies, they gave them stem cells and they found that it regenerates their surfactant a lot quicker than if they're just not given, number one. Number two, how much do we give? So they took an arbitrary number.
Okay.
They took an arbitrary number and we have been following that number, basically. It's not that I don't want to share you the number, but different doctors would choose a number, right? So basically, it's because we don't want to give too much. Secondly, cells are the cost goes by the amount of cells you take. But my own experience, it doesn't matter you have more. It doesn't matter.
Okay.
First thing it will do is your stem cells will do two things. It will go to any disease or damaged organ and try to fix it.
Okay.
So let's say you give X amount and it goes there and it all gets used up. Nothing is now left to go back to your bone marrow and nothing is left to make it younger or healthier or stronger.
Okay.
Right? So that is why patient must be open to this concept that if you feel, look, 6 months down the road, I feel about the same. Basically, it means that you didn't have enough.
I see.
Yeah.
But ultimately, the regime is decided by the clinician.
Yep.
Yeah. Okay.
So, as I said, it's the medical condition that you have or you want well-being. So the number of cells that we use for different conditions are different. Those that we use for medical condition has been researched. Those that we use for well-being is still a guess, but we use certain criteria to choose the number of cells for the patient and advise the patient that you may need a repeat. It doesn't matter how many times you repeat because it's safe.
It's safe. Okay.
Yeah. So the Japanese have their Japanese FDA have approved stem cell therapy in spinal cord injuries. Right. So you can order the cells if you have a patient with spinal cord injuries, you can order the cells and treat the patient in Japan. In the US, you can also do that, but you can only get the cells from the patient themselves.
Right.
That means you get from their marrow or you get from their fat tissue. Fat means wherever there's fat in usually the tummy. And then you can, after harvesting, you culture or replicate, and then you inject back into the patient. Okay? So by doing that, it's more costly.
I see. This episode is brought to you by Cell 101 International. Cell 101 International is a leader in cellular biotechnology, mainly focusing on regenerative medicine. So in terms of regulations on how this therapy is administered to patients, what is the snapshot look like for Southeast Asia? How our neighbors treating this therapy? How is Malaysia looking at these kind of therapies?
Okay, the number one country that does stem cell in this region is Thailand.
Okay, this must be aesthetic. associated with the aesthetics or?
Aesthetic, well-being, all are the byproduct of treating illnesses. Because they say, look, we give this, and patient says that there's some side effects, doctor. My face looks younger, I feel healthier, my hair is growing, and other things are happening. And my wife is happy with me and so on. So then they look into this, then becomes well-being.
I understand.
Aesthetic people are the first to move into this. And of course, then there are many clinics across the world where they're not, where pharma is not strong enough to stop it.
I see.
Where the government have got their own regulatory body, and then it's regulated. What's regulated is the lab. Okay, like even in Malaysia, the first thing the government wants to know is what are you trying to sell.
Fair.
We want to know how you get the mother cells and how you process it, and what's the end product, and whether it's safe to the patient. So as far as Malaysia is concerned, as far as I know, the government number one priority is safety for the patient. They don't want us to give something and then patient ends up with complications.
Right.
And then patient is going to be very upset, family going to be upset. So the idea is whether it's safe. So the government will come and look at your lab, approves your lab, and then look at your cells, and then so that's how they regulate it. So at the moment in Malaysia, the lab is regulated, but your sale is not regulated as yet. So they already had meetings this year, and by next year, I think they will then regulate who you can sell to, and so on, which is a little bit behind Singapore, because Singapore has already done their research. And they've already told the doctors, these are the things you can give. These are the patients we want you to give. And then we want the results of what you get. But we will catch up very quickly because we have a lot more patients than them.
Right? Just for clarity, as we speak today on the 3rd of May 2025, if a Malaysian patient is keen on this kind of therapy, is it already available to us or do we need to wait?
No, it's been available to us in the last 20 years. Yeah. So basically in the beginning, the doctor have to let his hospital know that he's interested in this therapy. Of course, initially started with medical conditions, and it goes through a hospital ethical committee. Right? So most new surgical procedures or new medications will have to go through the ethical committee, whether it's ethical to give, whether it's safe to give, whether there's enough research paper to show that it's a good thing for the patient. Once the ethical committee approves, then the ethical committee will send the report to the Ministry of Health for their approval. So one Ministry of Health say, okay, this hospital can start.
Right. So it's by hospital or by clinician? Both?
It starts with the clinician, and then it goes to the hospital, it goes to Ministry of Health, and then it goes down. So let's say, for example, a hospital gets its permission to go ahead and do stem cells. It also depends on the doctors who want to do. There are doctors in fields that they don't need to use stem cells. So, and there may be doctors in the field that is necessary, like for example, in my field of orthopedics and spine, it is essential that we get the permission to do. And therefore, it's been available a long time.
That's good to know. Are there any specific cases where stem cell therapy is not recommended? It's important for me to cover this.
That's at the moment. I think most of us do not know. I think the biggest worry is cancer. So if a cancer patient comes now and say that, I'm now cancer free, and I want to have stem cells to make sure I remain cancer free, there's not enough research to show that even on animal models, there's not enough research. So usually what happens is research starts with animal models, then it goes up to final human trials, right? So it's very hard, for example, as a patient with cancer got healed or got better, or the cancer is cancer free, and they want to try an experimental thing with the fear that maybe the cancer will come back. You can't get, very hard to get those patients, right? So that's why you start with animal models first.
Right.
If animal model shows enough evidence, then you can tell these patients, because at the moment, stem cells are used in patients with cancers that are resistant to the conventional treatment. Okay, a few pharma have got approval from their country, like Japan and Korea and US, where they can use this. They're more special, right? So, but they're more targeted.
Yeah.
Yeah.
Okay, so for those who are seriously considering this form of therapy, what kind of investment are we talking about, both financially and in terms of time? Is there any part of this that's covered by insurance?
Insurance don't cover stem cells because the insurance considers stem cells as experimental.
Okay.
So if a patient wants to do stem cell therapy, they have to pay for the cells.
Okay.
Insurance will pay for the procedure, right? Let's say if I'm going to inject into the spine, I'm just saying that I'm going to inject into the spine or into the cord and all that. Or into the knee. But they won't pay for the cells because it's not in the. They won't even pay for PRP in Malaysia. Okay, so but the procedure wise, you're doing a procedure.
So the procedure is covered.
The procedure is covered, but not the cells. So
And what kind of ballpark price range are we talking about in terms of cost for the stem cells?
It depends on the lab.
I see.
It depends on the lab. So for example, if you say outside of US. Say you go to Cayman Islands or British Virgin Islands or Costa Rica, Mexico, all that. So you are talking about 150,000 Malaysian ringgit, right? But in Malaysia, it range depending on the number of cells. It can range for 15,000 ringgit, 15, to up to 100,000 ringgit.
Right.
Yeah. So it depends on the number of cells that we need to give to the patient. For example, in the disc, right? The research has shown that we just need to give 20 million cells into each of the discs. Okay. So 20 million cells is not going to be expensive for the patient.
Understood. Okay.
The procedure is paid by the insurance. The cells, most patients, the cost is such that most patients can afford.
Can manage.
So that prevents them from having major surgery.
Okay.
Otherwise, you have to go in, remove the damaged disc, and then you have to replace with it. So the surgery alone may cost 100 to 150,000 ringgit.
Understood. Okay.
Right.
All right.
Not forgetting the pain and suffering of surgical procedures.
Yes, that's right. So I'm here today because of curiosity also. Let me just share something personal. My dad just finished CABG surgery. He had a bypass. And I noticed major surgery is such a taxing exercise for the body. When they're going through recovery, you can see how, when you had your chest open and now it's all sealed up, you have to relearn a lot of things. Breathing normally, using the stairs, everything can be a chore. So this is why I'm here today. So from what I understand, this is beneficial for most people who are going to go through surgery. In some cases, even prevent the need for surgery. And what motivates you to continue advocating regenerative medicine this way?
Oh, you can't stop. The train has left the station. Meaning that more and more research will be in this.
Okay.
Where of course there are some stumbling blocks. Because whoever can manage to create something is going to make lots and lots and lots of money, right? So, for example, in the US, the first thing, one of the things that Donald Trump did in his first presidency was to sign in an executive order saying that a patient can have stem cell therapy if you take from his own body.
Okay.
Right? So it's one day there will be a stem cell bank,
Yeah.
right? Just like
read about
now,
this.
there's a blood bank, bank, right? So it will be readily available for all patients. For once the research become more, two Japanese scientists have won a Nobel Prize each for stem cell research in the last 10, 15 years. So so it's going to go because, and at the latest health show in Tokyo, they've been able to regenerate a heart
Amazing.
from stem cells. Okay, so the train has left the station.
The
Either
future
you're
is here. Yeah.
Yeah, future is here already.
Yeah.
Yeah.
All right. So, what do you envision the future for all this going forward? Like, where else can this go? It's already quite sci-fi now.
No, it's going to be more targeted, more targeted, right? So basically, it's just drugs. For example, originally it's like generally,
Sure.
and then now it's organ. So if somebody's got liver disorder, we give you medicine for liver. If you got a heart disorder, we give you medicine for the heart. But the heart is made up, say, for example, or the liver is made up of many kinds of cells. So the target would be to go down and down and down, finally target the individual cells, and also maybe target whatever is inside the cell to make it healthier and make it, make it healthier so that it doesn't become diseased, right? So another big area would be, for example, like a patient who's got eye issues and they're going blind. Maybe you can prevent that.
Right.
And then let's say you can also prevent targeted cancer cells that are floating in your body, right? So that you don't get cancer. Right? So there's a lot of things that's happening, and it's going to be more. Rather than using drugs, see, the drugs is like a symptomatic treatment.
That's right.
A patient gets cancer, then we try to kill the cancer. But you cannot kill the mother cancer cell because you don't know where it's hiding.
So you manage the symptoms.
Yeah, you just manage the
Slow
symptoms.
down disease progression.
So whereas if you use stem cell therapy, you can train the stem cell to be a homing device for certain kind of cancers, and they can go in the body and look for these cells that are hiding here and there. So what chemo does is just kills everything, normal cells plus cancer cells. But the mother cells has got such a great defense, it's still hiding. So it can still come back a few years later. That's why they got recurrence. Whereas targeted stem cell therapy will look for these mother cells and knock the mother cells off so that you cannot produce more cells later, or you cannot metastasize. So that is one big, and plus all the other chronic inflammation diseases that give rise to chronic illness. Okay, so the research is along that way already.
Yeah. Unfortunately, I'm beginning to see like a conflict of interest here. If this works as well as you say it does and continues to do so going forward, maybe the role for pharma starts to get redefined a little bit.
I can't talk on behalf of the pharma, right? But my own understanding will be they'll find a way.
They will find a way. Okay.
Or they have to find a way to survive, right? So they will be also forced to do research where they can patent, right, certain technology,
Right.
where you need this technology. As I said earlier, one pharma company in the US has patented a technology where recurrent patients with leukemia, they get leukemia, get treated, and then it comes back a few years later. So they have this technology where they can target the resistant leukemia cells and kill those cells. Okay, so at the moment it costs $250,000 USD for that treatment.
I see. All right. So from what I understand today, you've spoken about examples where stem cells have been used for really young patients, really old patients. We can see the benefits across many kinds of disease at different stages of progression. Do you have any takeaway notes about this particular therapy for my listeners, especially those who are having a hard time finding information?
In Malaysia, it's not difficult. You just have to go and look into just write a stem cell therapy in Malaysia. So a lot of things, a lot of labs and doctors' clinic will pop out. Again, that's the difficult thing about for patient to choose. You see, the thing is that therefore you yourself to do your own research.
Right.
You yourself to choose the doctor,
Yep.
and then you go and see the doctor. It's fairly cheap to see a doctor in Malaysia,
Okay.
right, for consultation,
Okay.
because our fee is regulated by the government.
Yeah.
You go and have a consultation, and if you feel that you feel happy, this is like patient coming with surgery.
Yeah.
You got many choices. There are doctors who don't believe in some things, and there are doctors who are in the forefront of something. So you find those who are treating patients with stem cell, and you go and see them. The important thing to remember is that it's not something that will solve all the problem, because we haven't reached a stage where it's more targeted. So it's just beginning.
Okay.
Right? So in the beginning, about 20 years ago, you have to get the patient to sign that it's an experimental thing.
Okay.
But now it's not necessary.
Okay.
Okay, so it will slowly progress that way, until one day we'll have a bank, stem cell bank. That means anybody comes and they will be treated with if it's targeted. Right? So how we know all this is also because we know that organs regenerate.
Okay.
Right? For example, when I was a registrar in surgery, there was a young lady who had a very bad accident on the way to Ipoh. And the nearest big hospital is Kuala Lumpur.
Okay.
So they brought the patient to us. We checked her, and then we know that she had blood in the abdomen, so we had to open up. When we opened up, we found that the liver was badly damaged.
I see.
Okay, and it was so broken up that the consultant could only stitch whichever way he can to bring all the liver together.
Yeah.
Right. So after that, we put a foam that we call gel foam, which supposedly stops the bleeding because it was oozing. So we put this to stop the bleeding and left it there. And in the next 10 days, we could see that she was having fever swings. Okay, so we did a scan and found out that there was something over the liver. So we suspect pus. Uh-huh. So we went back to go open up her abdomen again, look at the liver. The liver has regenerated.
Wow.
Within the 2 weeks, it has regenerated. Okay, and what we saw that we thought it was pus is actually the foam still there. So we just removed the foam, and then she was okay.
Right.
So that's my personal experience of seeing an organ regenerating.
Okay.
As for orthopedics, I have spine patients that came quite badly paralyzed, and when they left the hospital, the best case scenario is they walked
Amazing.
home. The worst case scenario was they were walking, but like a robot, not normal. But at least they can get up from bed and go to the toilet, and so on. The most difficult part to heal from a spinal cord injury is passing urine. So a lot of them end up not able to pass urine, and so they have to have some kind of catheter or self catheterization, or even a tube coming out from the bladder and so on. That was the most difficult. Otherwise, in terms of walking, they are walking. There's one patient who had unfortunately injured his spine, and he was going to get married at the end of the year. His main concern was, can I walk during the wedding? So we managed to get him walking for the wedding, but he still had the catheter in him. Right? We couldn't manage to help there. So he just have to wear long pants and all that and carry the urine bag, but at least walking his wedding, right? So there are many examples of mine like that. Okay? I also have one example that did not do well, and he was very, very unfortunate. He was playing basketball, and his friend jumped to put the ball in the loop,
Yeah.
and that guy's knee went and knocked his neck, this
Oh.
patient's neck.
Uh-huh.
So there was a fracture dislocation of the neck. So he was treated in a government hospital, and then they sent over to our hospital. But he did not do well. So probably if you are severely injured, it may not work,
Right.
right? Or the number of cells we gave maybe not enough,
Yeah.
right? So for example, in Malaysia, for well-being, we are giving about 100 million cells. Okay. Because there's a formula for it. But in the Western world, they're giving 300 million cells.
Wow.
300 million cells.
Okay.
So who is correct? If you ask me, I don't know. I've asked many scientists across the world when I go and talk to them about regenerative medicine. The thing about regenerative medicine is all the major universities in the world have a department of regenerative medicine.
Okay.
They have. It's been there.
Okay.
Okay. So so they're constantly looking for something that can advance, patients' well-being. So why they are giving 300 million cells and we are giving 100 million cells? I can't find any papers. I've spoken to many scientists also. What should be the best? The only thing we got is from this research on the babies, where they gave this formula, and then we just extrapolate to adults. So what patient need to understand is you will find some response. But if you think not enough, basically it means that you have not enough. Your body is not producing enough. The idea is your body should also produce some.
Right.
The body is not producing to help you, and therefore you need to help your body by having another treatment.
Right.
Right. So it's like, for example, you have a fever, okay, and let's say you're 100 kilogram, and you take one tablet of 500 ml, it's not going to work.
Right. It does have correlation to your body mass.
Yeah. It does, isn't it? So it's not going to work. So maybe you need two. And then maybe you need two every 4 hours for the first day.
Understood.
Right. So
Okay.
similarly for the body, we haven't got the number. Right. So to me, I always tell patient, you try this number first because this is the number available at the moment. If you think it's not getting what the results you want, and you have been following all the good stuff to make your body regenerate new stem cells, maybe you need another dose 6 months down the road or 1 year down the road, and so on. Is it going to be something like, or do I have to have yearly or 2 yearly? Again, I cannot answer the question. I always tell patient that if you feel, it's not like a car where it says every 5,000 kilometers, 8,000 kilometers, you go and service, because the engine oil gets dirty, right? So, but to me, if you think that you need another booster yourself, just come and get it. There's no harm, right? They just will make you better. I have patients who have come every year from overseas for well-being, right? Because they said that at least one patient said that his father used to get it from Europe, right? Animal stem cells.
I see.
And he found that his father was doing very, very well. And now that he knows that he can get these cells from placenta, which is the commonest way we get. So he comes every year and get his cells. He feels good. Yeah.
That's really good to hear. I mean, it's clear that this is a lot of advancements in biotechnology probably have happened, through these years to make this available at this level. I suppose from what I'm hearing, it's important for the clinician to be heavily involved with the regime and the treatment plan. Any advice to patients who might want to circumvent the normal process to obtain this? Some people out there might want to go and get it on their own directly. Is that even possible, or is there a risk there?
The labs don't sell directly to the patient.
Okay.
Usually in Malaysia, wherever the patient goes, a doctor will be the person assessing.
Okay.
There may be, inverted commas, agents or people who promote this for the lab or for the doctor.
Fair.
But ultimately, the patient must come and see the doctor.
Correct.
Even in my case, some doctors have got the patient and they refer the patients to me, even though that doctor is able to get the cells from the lab. Okay, basically, the doctor wants a doctor trained or specializing in this sort of thing to assess the patient before giving the cells.
Okay.
But there are also other patients who get this cell therapy from doctors. At the moment, the beauticians and so on cannot buy it from the lab. The lab won't sell.
Okay.
Because the government is still in the process of regulating, right? So they don't want to be caught. Last year you gave to X people. So now they only focus on doctors.
Okay.
So that they are on the safe side of the line, right?
Perfect.
So for the doctors, there are doctors who will do it because they believe in it, and I think they are right because you cannot stop this. Okay, Japan is into it, Korea is into it, US is into it. Europe has been in it for a long time. So it's just a refinement, getting better and better, more targeted kind of therapy, and therefore you find that the patient should go and go and check on the website or word of mouth and see which doctor you think can give you a good answer to your questions.
Yeah.
And then and then you choose whichever. The labs in Malaysia are limited. There are only a few labs that provide the cells.
Understood.
Okay. The thing about these cells is that if you harvest the stem cells from the patient from the placenta or cord blood, you can store it. You can store it forever.
I see. Okay.
Right?
Okay.
But once you take out and thaw it and culture it and you replicate it, it has to enter the patient's body within 6 hours.
Okay.
Unless you want to store that again.
Oh.
Right? Okay. So there has been research on, can we have, some call it line, some call it generation. That means the first generation of the cells is from the placenta, and then you grow that, and then you keep some, and then you grow that, and you keep some, and then maybe it goes on to generation 20.
Right.
All right. So no, that's no good.
I see.
Research has shown that the more generations you have, the higher chance for it to mutate. Okay, mutate means it'll become a mutant cell, and mutant cells can either be good or bad for you. Usually, it's not so good for you.
Right.
Right. So, so maybe a patient should also ask what generation of cells I'm getting.
I see.
Right.
Okay.
So you don't want 25 cells because that's been cultured, right?
And these processes are regulated by the government and imposed on the labs.
Nope.
No.
The government only wants to know whether your culturing and replication is safe. There's no evidence of infection because these are all live structures, and you inject into the patient. If the patient get infected with bacteria or viruses and all that, so the lab has to be super clean. But all this the lab knows because the government comes and check the lab.
Okay.
It's just that the government has not regulated whether all patients should get generation 1 to generation 5 or now you might get. That is why I think some patients say, hey, look, I don't feel the same result as the first time. Maybe first time generation 2, 3 cells. Maybe now generation 25 cells. I don't know.
Okay.
Right? So in Malaysia, a patient can go to the lab and see the lab if they want. They can go to the lab and see the lab and happy with the lab, and ask the question, what generation of cells are you giving? Because science has proven that if you go down the ladder, there's higher chance of mutation,
Okay.
right? So which level it mutates worse, we don't know,
Okay.
right? So, for example, in Malaysia, I cannot understand why you want to give generation 25 because there are a lot of placenta freely available
I see.
and just gets thrown in the
It's medical ways.
as medical waste, right? Plenty. So the beauty about getting the placenta from local patients is that it's readily available. Number two, if that patient agrees to have a placenta donated to the lab will do a lot of tests on her, FOC, to make sure she doesn't have anything, right, that may be detrimental to the patient.
To ensure that she's a viable source.
So that the risk doesn't cause any problem to the recipient. But having said that, the cells that you get from this placenta has also been proven that it will not turn into cancer.
Okay.
It will not. That they have done the study and have found that it does not. Okay, in the sense that if, for example, say the mother has a family history or family history of cancer of the breast, say for example, because we know that certain cancers runs in the family, and then you take this placenta from this baby who's a woman, who's a baby girl, and then you give to somebody, will that patient's DNA be transferred into the recipient? No, it doesn't.
Okay.
It doesn't. Okay. So that is why, again, they don't understand. I mean, science doesn't understand why somebody get cancer and somebody don't get. Right? So the thing that we know is that your cells that you get injected with doesn't transfer the DNA into you. Number two, it's protected. Your defense mechanism doesn't go and kill
Attack it either.
Yeah.
Okay.
So it goes to repair whatever tissue that is needs repair or regeneration, and the rest is like a homing device. They go and stay in your bone marrow.
Fantastic. Okay, so hearing about what stem cells therapy can do, the potential to help the body heal itself, gives me hope. Not just for my dad, but for so many others who are looking for alternatives, just to manage symptoms, but actually aim to regenerate what's been damaged. If you or someone you love is facing a long-term recovery or a chronic condition, I hope today's episode has opened up a new way of thinking about what's possible. This field is evolving quickly, as we are hearing, and the future of healing might already be here. We just need to reach for it. Thank you very much for listening. I hope you continue to be discerning. Ask as many questions as you can to your clinician or whoever's advising you. And thank you for listening. Thank you for your time.
Thank you
Dr.
very
Pang.
much. Thank you.
This episode is brought to you by Cell 101 International. Cell 101 International is a leader in cellular biotechnology, mainly focusing on regenerative medicine.